Hello everyone, welcome to my YouTube channel with a new video. I hope you all are fine and doing great. Well, before watching the full video, don't forget to subscribe my YouTube channel and press the bell icon. In this video, we will discuss about the most common and most important psychological disorder named as schizophrenia. If you are a psychology student and have some interest about knowing the psychological disorder, then this video is very useful for you because in this video we are going to learn about the major psychological disorder in the field of psychiatry. We will start with its definition. We will try to learn this disorder in a very simple language. American Psychiatric Association APA defines schizophrenia as it is a severe chronic mental disorder characterized by disturbances in thought, perception, and behavior. Means that schizophrenia is a severe mental disorder which disturb the thought pattern, how one thinks of an individual, how one perceive perception, and how one acts behavior. The major mental processes are disturbed due to this psychological disorder. Schizophrenia by DSM-5 Diagnostic and Statistical Manual of Mental Disorder. Schizophrenia is a chronic mental illness with positive symptoms and negative symptoms. Positive symptoms include delusions, hallucinations, disorganized speech and behavior, negative symptoms, and cognitive impairment. These three domains are characterized by DSM-5 for schizophrenia disorder. In next slides, we will discuss about the positive negative symptoms and cognitive impairment. Positive symptoms number one, which include is delusions, which are fixed beliefs that are not amenable to change in light of conflicting evidence. You can remember the difference between delusions and hallucination by this simple definition that delusions are fixed beliefs, right? Which include a variety of things named as persecutory delusions, referential delusions, grandiosity, erotomanic delusions, nihilistic delusions, and somatic delusions. If we simply define these delusions in a single line, then persecutory delusions, for example, belief that one is going to be harmed, harassed, and so forth by an individual, organization, or other group, are most common. Simply means that a client with persecutory delusion is with this fixed belief that someone is going to be harmed or harassed him or her, right? Referential delusions, for example, belief that certain gestures, comments, environmental cues, and so forth are directed at oneself are also common. Means that with
in
referential
referential
delusions,
delusion, a
an
patient or
individual or
client is
client or
with this
patient
fixed belief that
all the environmental cues are directed to him or her, all the comments or gestures are directed at oneself. In grandiosity delusions, as it indicates with the name that grandiosity, in grandiosity delusions, for example, when an individual believes that he or she has an exceptional abilities, wealth, or fame, means a person with grandiosity delusions believe that he or she has some exceptional abilities that no other has. These abilities, if we define erotomanic delusions in a single line, for example, when an individual believes falsely that another person is in love with him or her, means a person is not sure about that the other person is in love with him or her. It's a false belief that individual has. Nihilistic delusions are defined as these type of delusions involve the conviction that a major catastrophe will occur, means that a person with this false belief that something bad or worse is going to happen, means that there is no indication of major storm or wind, etc., but the patient is predicting and falsely believing that something bad or major catastrophe will occur within hours or within days. Somatic delusions focus on preoccupations regarding health and organ function, means that a client with somatic delusions or falsely believe that about his or her health and organ function, that someone has installed some body parts in him or her. As client in psychiatry department with somatic delusions also complain that someone has installed a chip in my body and uh, recording my body functions, etc., right? Like these type of delusions, these all type of delusions, persecutory, referential, grandiosity, erotomanic, nihilistic, and somatic delusions are most common type of delusions which comes in the category of positive symptoms of schizophrenia as per DSM-5. So as a psychology student, you must aware of these six type of delusions which are most common in patient with schizophrenia. Other positive symptom of schizophrenia disorder as per Diagnostic and Statistical Manual of Mental Disorders is hallucinations. Hallucinations are perception like experiences that occur without an external stimulus. Means that hallucination are those type of perceptions that a person experience without the presence of an external stimulus. They are not under voluntary control. They may occur in any sensory modality, but auditory hallucinations are the most common in schizophrenia and related disorders. Hallucinations may be in sensory form or auditory hallucinations. Auditory hallucinations may be defined as uh, are usually experienced as voices, whether familiar or unfamiliar, that are perceived as distinct from the individual's own thoughts. Means no external stimulus is present, but a person is complaining that he is listening some voices or he's experiencing some voices, whether familiar or unfamiliar, right? Hypnagogic and hypnopompic hallucinations. Hallucinations are those which occur during falling asleep, whereas hypnopompic hallucinations are those which occur while waking up. While moving towards the third positive symptom of schizophrenia disorder as per DSM 5 is disorganized speech, which is also termed as disorganized thinking or formal thought disorder in DSM 5. Disorganized thinking or speech is typically inferred from the individual's speech. The individual may switch from one topic to another, which is called loose association. This disorganized speech include loose association, tangentiality, and incoherence. Loose association is defined as a person, the individual or client may switch from one topic to another. This is called loose association. Tangentiality. In tangentiality, answers to questions may be obliquely related or completely unrelated. Means we are asking something else to the client and client is responding to unrelated answers, right? Incoherence, which indicates with the name that is nearly incomprehensible and resembles receptive aphasia in its linguistic disorganization. Other key features that define the psychotic disorder are the negative symptoms include diminished emotional expressions, avolition, alogia, anhedonia, and asociality. These four A's for the negative symptoms are must to remember. While defining the diminished emotional expression includes reduction in the expression of emotions in the face, eye contact, intonation of speech, and movements of the hands, head, and face that normally give an emotional emphasis to speech. It simply means that client with diminished emotional expression is with no emotional expression. Right now, evolution is a decrease in motivated, self initiated, purposeful activities. While let's elaborate it more, the individual may sit for long periods of time and show little interest in participating in work or social activities. Means person with evolution is with no interest. A here represents that no interest, A absence, alogia, A absence, and hedonia and asociality. This A shows the absence. Second, a alogia is manifested by diminished speech output, means patient with this negative symptom is totally stupor and don't respond to anything. Anhedonia is the decreased ability to experience pleasure from positive stimulus or a degradation in the recollection of pleasure previously experienced, means lack of pleasure is anhedonia. Asociality, which also indicates with the name, refers to the apparent lack of interest in social interactions and may be associated with evolution. Means client with asociality or a negative symptom of asociality is with the social withdrawal. These are the some positive and negative symptoms of schizophrenia disorder characterized by DSM-5-TR. Now let's move towards the other psychotic disorder, their diagnostic codes and diagnostic tool. Means that how can we diagnose a person or client with psychotic disorder? As we know that DSM-5 TR or DSM is divided in some sections and chapters. So disorders in DSM-5 which are which describe the psychotic disorder include seven type of disorder: delusional disorder, brief psychotic disorder, schizophreniform disorder, schizophrenia, schizoaffective disorder, substance or medication induced disorder, and psychotic disorder due to another medical condition. These seven type of psychotic disorders are mentioned in DSM-5. You can learn their diagnostic criteria and other important features from DSM-5 manual. The diagnostic tool which is used for the psychotic disorder is named as BPRS, Brief Psychiatric Rating Scale, which is easily available on internet. You can download its PDF form and can learn or practice this diagnostic tool for the patients with schizophrenia disorder. The specialty of this tool is that it is so simple and easy to use and consisted of 18 items which are very easy to measure the severity level of patient with schizophrenia disorder. Treatment or management plan for the schizophrenia disorder includes medication, means antipsychotics, or psychotherapy, which includes CBT or psychoeducation to the family. It depends upon the nature of the disorder, situation of the client, condition of the client or family. If the client is needed for the indoor treatment, then client is admitted or rehab in hospital settings, or the client is treated on outdoor basis. It depends upon the severity level or severity index of the disorder. Let's end the video here. I hope that you have learned a lot of things here in this video. I tried to deliver in a very simple language with very simple definitions. Don't forget to subscribe my YouTube channel and must share this video with others. Stay blessed, stay connected, stay safe. Allah Hafiz.